Hello, let us continue with our session on collection, storage, and transport of specimens. Let us learn about CSF sample collection and storage. CSF is submitted for microbiology analysis whenever meningitis or encephalitis is suspected. For meningitis, the likely infection agent differs depending upon the duration of symptoms. The most likely bacterial agent of meningitis will also vary with the age of the individual and whether the disease is community or healthcare associated or conjugal acquired. Most infectious cases of encephalitis are a result of viral infection, both arthropod and non-arthropod borne. Parasitic infections of the central nervous system also occur with varying clinical presentations. The probable infectious causes of meningitis include, based on the duration of symptoms, if it is less than 24 hours, then pyogenic bacteria. If it is about 1 to 7 days duration, then enteroviruses and pyogenic bacteria. If it is more than 4 weeks, then Mycobacterium tuberculosis, Staphylococcus, Brucella, Candida, Leptospira, Borrelia, Cryptococcus coccidioides, Histoplasma capsulatum are the causes of more than 4 weeks of duration. Regarding the collection instruction, the CSF sample must be acquired using aseptic technique. Submit the second or the third tube collected for microbiology examination. The minimum volume for bacterial testing is about more than 1 ml. For fungi, it is more than 2 ml. For AFB, that is Mycobacterium tuberculosis, it is more than 2 ml. For viruses, it is more than 1 ml. Submit it in a sterile screw cap. Transport to the laboratory promptly and process as soon as possible. If a delay is unavoidable, the specimen should be held at room temperature, it should not be refrigerated. Avoid the use of large capacity sterile container, as small samples are difficult to retrieve. Samples are being submitted for viral cultures only, should be held or stored at 4 degrees Celsius. So the lab diagnostics testing include gram staining, antigen testing, indicing test, dark field microscopy, acid fast staining, bacterial culture, yeast and fungal culture, and viral cultures. Sample must be acquired using aseptic technique. Sterile screw capped transport container should be used. For bacterial culture, the volume is about more than 1 ml. Fungal culture is more than 10 ml, and AFB culture is more than 10 ml. The fluid should be transported as soon as possible and should be held at room temperature. For urine, from an indwelling catheter, decoration instruction includes to disinfect the catheter with 70% alcohol. Use a needle and syringe to aseptically collect 510 to 10 ml of urine. Transport the sample to sterile container. Urine from straight catheter, the instruction include thoroughly cleanse the urethral area with soap and water, rinse the area with wet pads, aseptically insert a catheter into the bladder, and allow approximately 15 ml to pass. Collect the urine in a sterile container. Urine from mid-stream urine sample, the instruction include for a female, while holding the labia apart, begin voiding. After several milliliters have been passed, collect a mid-stream portion without stopping the flow into a sterile container, or if using a swab, move the swab sponge into the urine stream. Ensure that the sponge is wet. For males, the instruction include retract the foreskin, begin voiding. After several milliliters have been passed, collect the midstream portion without stopping the flow into a sterile container. Or if using a swab, move the sponge into the urine stream. Ensure that the sponge is wet. Collect the urine in a strict, sterile, leak-proof stew crab container. If it is less than 2 hours of storage transport, and held it at room temperature. If it is more than 2 hours, store at 2 to 8 degrees Celsius. Have the for the sputum, for the exported sputum, have the patient rinse or gargle with water to remove the superficial flora. Avoid antiseptics. Instruct the patient to cough deeply to produce lower respiratory secretions. Collect it in a sterile container. For induced sputum, have the patient rinse the mouth with water after brushing the gums and tongue. Using a nebulizer, have the patient inhale about 25 ml of a 3 to 10% sterile saline solution. Respiratory therapists should collect a specimen via suction from pediatric patients unable to produce a sputum sample. Collect the induced specimen in a sterile container. Sputum for acid-fast bacillus culture should be collected on 3 consecutive mornings for diagnosis. Optimal volume for Mycobacter culture is 5 to 10 ml. Minimum volume is 3 ml. The minimal volume needs to be collected into a screw cap container with no preservatives. If it's less than 2 hours, hold at room temperature. If it's more than 2 hours, store at 2 to 8 degrees Celsius. Regarding surveillance culture for anaerobic antimicrobial resistant organisms such as MRSA or VRE, that is medicine resistant Staph aureus or vancomycin resistant enterococcus. It is nasal swab for MRSA, it is wound swab for MRSA, rectal swab for VRE. Decoration instruction for nasal swab includes insert the swabs pre-moistened with saline, approximately 2 cm into the nares, rotate the swab against the nasal mucosa. Both the nares should be sampled using the same swab. For rectal swab, insert the swab into the rectum through anal sphincter and gently rotate. Regarding abscesses, remove the surface absolute if present by wiping an open abscess with sterile saline or 70% alcohol. The closed abscess should be aspirated with a needle and syringe after sterilizing the skin with chlorine preparation or isopropyl alcohol. The swab should be transported as soon as possible and hold it at room temperature. If it is an aspirate, hold at room temperature. Aspirate, if possible, is always superior to a swab specimen. A request shall be made for more than one test on a swab. Then the bacterial culture aerobes, bacterial culture anaerobes, and fungal culture. Then please ensure that separate swab is collected for each test. Failure to provide swab test, separate swab will result in suboptimal. Regarding the collection instruction for tissue or biopsy sample, the sample must be acquired using aseptic technique. For small samples, add several drops of saline to keep them moist. Do not allow the tissue to dry out. NRV transfer system or sterile screw cap container specimen containers should be used. Do not add the preservative. Always submit as much as tissue as possible. Transport as soon as possible to the laboratory and store at room temperature. For the wound swabs, the instruction include remove the surface exuded by wiping with a sterile saline or 70% alcohol. Sample must be acquired using aseptic technique. Sampling of the surface area can introduce colonizing bacteria not involved in the infection process. Its sample should be collected into the sterile screw cap specimen container. The transport, if it is less than 2 hours, store it at room temperature. If it is more than 2 hours, store at 2 to 8 degrees Celsius. The picture shows how to create a nasal swab. Insert a swab as mentioned before with a saline, 2 cm to nails, rotate the swab and get a nasal microbial. Correct it into the sterile screw cap specimen container. If it is less than 2 hours transport, store at room temperature. For more than 2 hours. For throat swab, as you can see from the picture, depress the tongue with a tongue depressor and sample the posterior pharynx, tonsils, and the inflamed areas. The sample should be collected into a screw cap specimen container, and if the transport time is less than 2 hours, store it at room temperature. If it is more than 2 hours, store at 2 to 8 degrees Celsius. The screen scraping for the dermal fat cultures, the instructions include cleanse the affected area with 70% alcohol. Gently scrap the surface of the skin at the active margin of the lesion. Do not drop blood. Place specimen in a sculling container or a black glassine paper then into a clean container. The sample should be collected in a sterile screw cap container and the transport time is less than 2 hours, store at room temperature. If it is more than 2 hours, store at 2 to 8 degrees Celsius. That was all about from the 2 sessions about the sample collection, storage, and transport for required for microbiology testing. Thank you.